Hi everybody, Dr. Ahles here. In this short video, we're going to talk about the different kinds of birth control, along with the benefits and the disadvantages of each kind. When we talk about birth control, big picture, the goal of birth control is to prevent pregnancy. So there's a couple of primary ways that this is done. Way number one would be to prevent the process of fertilization. So if we go way back to the very beginning and prevent the sperm from meeting the egg, this would prevent pregnancy. So the main kinds of birth control that prevent this process of fertilization are things like physical barriers or behavioral modifications. Now notice from my list over here that physical barriers that we see right here, things like a diaphragm, a condom, a sponge, or a cervical cap, these are about 78 to 82% effective. Behavioral modifications, things like ovulation tracking, things like the withdrawal method, those are less effective than those physical barriers. But I do want to point out that when we start talking about things like hormonal birth control measures, or things like an intrauterine device, these are things that would prevent the process of implantation as opposed to just fertilization. And when we start looking at these kinds of measures, notice that they're going to be a lot more effective. So with doing something like receiving hormonal shots or wearing a patch that slowly releases hormones. These are measures that would be a little more passive that someone wouldn't have to remember to do every day, for example. Something like taking a pill as a hormonal birth control method can be highly effective as long as you always remember to take that pill. Something like an IUD that you put in once and leave in until either you're ready for conception or you need to trade it out. Those kinds of things like an IUD or an implant, these things are almost 100% effective, so they're a very effective form of birth control. But you can also use the process of sterilization as a method of birth control. This is a little bit different than the two types of birth control that we mentioned up here, because as opposed to blocking fertilization or as opposed to blocking implantation, what sterilization does is it actually prevents the gametes from ever being released. So when we talk about sterilization, this can be done both in men and women. In men, this is called a vasectomy, and when we talk about a vasectomy, we cut the male reproductive structure called a vas deferens. By cutting the vas deferens, there's not a tube for the sperm to leave the testes, so they're not going to enter the ejaculate. So the rest of semen will still be formed, it'll just be missing that 10% that had the sperm in it. In women, the process of sterilization is typically called a tubal ligation. So when a woman has a tubal ligation, what happens is the oviducts, also known as the fallopian tubes, are sealed shut. So as an ovum or as an oocyte is released, it is going either into a tube that doesn't lead to anywhere, or it may just dissolve. The other method of sterilization that can be used in women is called a hysterectomy. And a hysterectomy is a little bit different from a sterilization perspective in that what's actually being removed is the uterus. So gametes may still be released into the oviducts, but the oviducts don't lead to a structure anymore, meaning that there's no location for fertilization or implantation to occur. Now, when we think about each of these different forms of birth control, like I mentioned, some are more effective than others. And when we start talking about sterilization, for the most part, we're talking about something that's very permanent. Some of these more effective forms of birth control, like an IUD or an implant, they are very effective and they are longer lasting. As we start getting into these more shorter term methods of birth control, notice that efficacy also starts to go down. So as you're considering what form of birth control might be best for you, it definitely can't hurt to use more than one type, whether it's some kind of physical barrier like we see down here, or a behavioral modification, or things that are more hormonal or more permanent. All of these are different ways to prevent a pregnancy.